Incidence is the number of new cases of a specific disease or health condition occurring in a defined population during a specified period. This epidemiological indicator provides a measure of disease burden and insights into the risk of developing the condition within a given timeframe. Calculation of incidence can be represented as a proportion. While it is a proportion, it is important to specify the time period when reporting cumulative incidence. Cumulative incidence is frequently referred incorrectly to as a rate. It really is the proportion of people who develop the outcome during a fixed block of time. Incidence proportion, or the cumulative incidence, measures the number of new cases per person in the population over a defined period of time. Sometimes this calculation uses the population at risk at the beginning of the considered time period. If you are using this to report incidence in a population that you know, then it is easy to know the population at risk at the beginning. However, when we don't have the estimate of the population at risk at the beginning of the study period, using an estimate of the total population at risk for the whole year is fine too. For example, let's say there were 4 cases of brucellosis in Verona area of California for the period of January 1, 2023, through December 31, 2023. Brucellosis is a bacterial infection caused by Brucella species, such as Brucella abortus or Brucella melitensis. They cause diseases in animals, especially cattle, goats, sheep, and pigs. However, these bacteria can transmit from animals to humans because of touching and feeding infected animals, or drinking unpasteurized milk, or eating cheese made out of such milk. In rare cases, if you're a farm worker, you could inhale the aerosol particles carrying the bacteria while you're at the barn, and subsequently catch the disease. The infection ends up causing fever, headaches, back pains, and physical weaknesses. Because people can catch the disease from animals, we call it a zoonotic disease. Brucellosis is a reportable disease in the U.S., meaning if you become sick and went to a clinic or hospital and get diagnosed that you have brucellosis, the clinic will report that there was a case of brucellosis to the California Department of Health. This reporting is important to monitor, control, and prevent the spread of diseases within a community. Brucellosis is a good example of a disease of One Health relevance. While drinking pasteurized milk only, wearing protective masks, and washing hands after working with animals are good preventive measures. To really prevent disease in both animals and humans, we need to work with doctors, veterinarians, and environmental scientists to target the control measures after knowing the ecology of how these bacteria survive, evolve, and propagate in animals, contaminate, and stay on what surfaces, and at which temperatures and humidities, etc. Now, going into the calculation, the estimated population at risk living in Verona, California, in 2023, is 30,000 people. Since all our new cases reported in 2023, the cumulative incidence is 5 divided by 30,000 people, resulting the incidence proportion of 0.000167, or as a percentage equals 0.0167%. Now, this was an example of an observational study, where the calculation was based on only the reported cases. If, take the example of an incidence-based approach of a clinical study, follows individuals in a pre-identified study population, records their health status predetermined over time. If looked into related terminologies, prevalence is commonly confused with incidence. Prevalence is the total cases present at one specific time, or during a period including both new and old cases, whereas incidence is the rate of new cases or events during a specified time period for a population at risk. Incidence rate, as it indicates, should contain the time in the calculation. Because if it is a rate, it indicates the need to include a measure of time. The incidence rate is a more accurate estimate of the rate at which the outcome develops. In epidemiological studies that intend to calculate incidence, often follow groups of people as they move through time. Therefore, the denominator is actually a combination of the number of people and the amount of time. This is expressed as person time. The time units can be expressed in days, months, or years. Usually that depends on the length of the study. The most common one is person years. For example, let's assume in January 2023, the cows on a farm in Verona, California, had an outbreak of brucellosis, with many cows having abortions and giving birth to calves that are dead. The farm managers signed up to eradicate the disease from the farm, with the help of veterinarians in the Veterinary Health Branch of California Department of Food and Agriculture. For this, milk samples from cows of the farm were collected every month and tested using Brucella milk ring test. If the milk ring test was positive, then blood was drawn from that cow to test and confirm the infection. Brucellosis is an economically challenging disease to a dairy farm because the disease causes abortion, birth of stillborn or weak calves, and reduced milk production. Depending upon the stage of the program in an area or country, seropositive cows are often culled to make sure the infection is removed from the farm. In parallel, let us assume that California Department of Public Health collaborated with the Veterinary Health Branch of California Department of Food and Agriculture to do this hypothetical clinical trial to determine whether farm workers in this farm tend to get infected with brucellosis. 12 farmers whose age was between 20 to 45 years old participated in the study. The first 5 farm workers started working at the farm and were enrolled in January 2023, and were 7 new farmers joining the study a month later, in February 2023. The farmers' potential exposure to brucellosis began upon enrollment as indicated by the solid black dots. Blood from all participants was tested every month, using serological tests to detect antibodies against the bacteria. The study went on from January 2023 through March 2024. Because the cows were no longer detecting positive for brucellosis, the farm is declared free from brucellosis, and the remaining animals were vaccinated against brucellosis in March 2024, and samples from the barn environment, such as milk buckets, farmer coveralls and boots, and other surfaces, were also tested for any trace of the bacteria using PCR, and confirmed infection is no more. Subsequently, the study on farmers was stopped, assuming there is no high risk of exposure. The red excess indicates when subjects had an infection of brucellosis or antibodies were detected in their blood, even if they did not develop the disease. That means the farmer's immune system had done a good job fighting the infection. For the study, their exposure time at risk ends the X marks. Subject number 2 was detected with antibodies against brucellosis in November 2023. Subject number 5 had developed the disease in May 2023. And subject number 11's blood test was positive for antibodies in September 2023. The red excess indicates when subjects had an infection of brucellosis or antibodies were detected in their blood, even if they did not develop the disease. That means the farmer's immune system had done a good job fighting the infection. For the study, their exposure time at risk ends the X marks. Subject number 2 was detected with antibodies against brucellosis in November 2023. Subject number 5 had developed the disease in May 2023. And subject number 11's blood test was positive for antibodies in September 2023. The open circles indicated 6 subjects who were lost to follow-up, because either they did not want to be in the study anymore, or left the farm. So, in the calculation, they stop contributing to exposure time at risk. For example, farmer number 1 was lost to follow-up in September 2023, number 6 in February 2024, number 7 in September 2023, number 8 in January 2024, and so forth. In this case, when we calculate the incidence rate, the denominator takes into account the total amount of at-risk time for the group, which is the number of months each person was followed up. Therefore, the incidence rate here is 3 out of 105 person months of observed exposure time of 15 months from January 2023 through March 2024.